Hi everyone, I'm at that 1 o'clock and we've got lots of exciting things to be talking about today, so I think we should make a start. So welcome everyone to this webinar on handling missing data in the 1970 British Cohort Study. My name's Richard Silverwood. I'm an Associate Professor of Statistics and the CLS Chief Statistician at the UCL Centre for Longitudinal Studies. And Michaelis and Brian are with us today also. I'll ask them to introduce themselves in just a second. So just a quick rundown of what we're going to be discussing over the course of the next hour. So I'm going to give a very quick introduction to the BCS 70 and then an overview of the missing data strategy that we've been rolling out across the cohorts that we run at the Centre for Longitudinal Studies. And then Michaelis will go into some detail on the application of this strategy in BCS 70. So Michaelis, do you want to just briefly introduce yourself?
Yep, thank you very much, Richard. Hello, everybody. My name is Michalis Katsoulis. I'm an associate professor in biomedical statistics at the MRC unit of lifelong health and aging, and my main research interests are in causal inference and missing data.
Thank you. And then at the end, hopefully we'll have plenty of time for a Q&A, and we'll be joined then by Brian. Brian, do you want to introduce yourself?
I'm Brian Dodgen. I've worked at the Centre for Longitudinal Studies since 1990, and I've worked on all four studies: the 1958 Cohort Study, 1970 Millennium Cohort Study, and the Next Steps Cohort Study.
Thank you, Brian. So first of all, just a brief bit of housekeeping. I think the settings are such that you won't be able to use your microphone anyway, but if you do have a question, which we'd encourage you to have, then please use the chat function within Teams. Note that your question will be visible to all attendees. If it's a pressing administrative issue, then we might respond immediately. But if it's a more substantive question about the content of the webinar, then we'll probably defer responding until the Q&A session at the end. But please do feel free to start asking your questions at any point during the webinar. If there's any technical issues, then please use the email address on the screen there. And at the end, there will be a link to a short feedback survey. And we'd be really grateful if at the end of the webinar, you could click on the link, complete the short survey. It's very helpful for us in terms of knowing how effective the training that we run is being and how we can improve that to make it more effective in future. And again, thank you for joining us. So first, I'm just going to give a quick introduction to BCS 70. And in fact, I'm going to start with a very brief introduction to the UCL Centre for Longitudinal Studies. So this is where myself and Brian work. It's home to a unique series of UK national cohort studies. Between them, these follow the lives of tens of thousands of people across the UK. I'll mention each of the main cohorts that we run in a minute, but each of these follow large nationally representative groups of people born in a given time period, usually a given week within a year, or perhaps births over the course of a year or two. Then individuals are followed up over their lives and collect lots of information from them, usually across a variety of different areas. And by doing this, by gaining this very rich source of data, and then we have very powerful data sets in which to address important research questions. And I should say at CLS, we conduct a lot of research ourselves, so substantive research, both using the data that we've collected as part of these national cohort studies and other data sources, but also methodological research. So survey methods research to help us implement our own studies in the best way possible, and statistical methodological research like the work that we're presenting today, with the idea that we can then provide guidance to the users of our data sets to ensure that they're being utilized in the best way possible. So as I say, at CLS, we run a number of different national cohort studies. So the four in the middle here are our kind of core cohorts. So the National Child Development Study, NCDS, follows individuals born in 1 week in 1958. The 1970 British Cohort Study, BCS 70, that we're going to be discussing today, follows individuals born in 1 week in 1970. Next Steps follows individuals born in 1989 and 1990. And the Millennium Cohort Study follows individuals who were born between 2000 and 2002. We've recently started conducting a feasibility study that we're calling the Early Life Cohort, which are births that have occurred very recently in the last couple of years. And at the other end of the spectrum, we also work very closely with colleagues where Michaelis works in the MRC Unit for Lifelong Health and Aging, where the National Survey of Health and Development following individuals born in 1 week in 1946 is run. So these timelines, I think, give a nice idea of when we've collected data in these 4 core cohort studies. So the points that you see here are when we've collected data. So you can see that for MCS, BCS 70 and NCDS, we start collecting data at birth in the cohort members, and we follow up collecting data at fairly regular intervals thereafter. Next Steps looks a bit different, and that's because the cohort members in Next Steps weren't recruited until they were age 13 or 14, and then they were followed annually for the first few years, and then slightly less regularly afterwards. So the focus today is going to be the 1970 British Cohort Study, or the BCS 70. So I'll talk about that in a bit more detail over the next few slides. So this is an ongoing, multidisciplinary, very rich longitudinal birth cohort study. People born right across the UK, so England, Wales, Scotland and Northern Ireland in 1 week in 1970, although those individuals born in Northern Ireland weren't followed up after birth unless they moved to the mainland. It's got an initial sample size of over 17,000 individuals. But there are also some boost samples through childhood up to age 16 of individuals who were born outside of the UK, but moved to UK or moved to Great Britain subsequently. And through those boost samples, they are then included from that point onwards within the sample. So it's collected information on a variety of different areas: health, physical, educational, social development, economic circumstances, and lots more besides. So we'll look a little bit in a second at the different areas in which data have been collected. So this slide now shows for BCS 70 the different waves of data collection that have been conducted approximately every 5 years or so from birth onwards. At birth and through childhood, the main respondents were the mother or the parents, and then this transferred to being the subject of the study, the cohort member themselves, through teenage years and adulthood. There are also some additional respondents, so sometimes the teachers or the people at the school will provide additional information, and there's additional medical information that we capture. This survey is generally run face-to-face. In BCS 17, there's a few additional survey instruments that are used in addition to a standard questionnaire. So there's been lots of cognitive assessments throughout the life course of these individuals, and additional data collections using some other different instruments. At the age 42 wave of data collection, we collected consents from the cohort members to link their survey data that we've been collected throughout their lives into different administrative data sources, including health data, so for example, hospital episode statistics, and some financial economic data as well. And as you can see from the bottom row, the response has declined somewhat over the years, as is typical in these long-running longitudinal studies. So although we started off at birth with around 17,000 respondents, by age 46 we were down to 8,500 or so. So although we may at the most recent sweep here have failed to observe around half of the individuals, although some of them will have left the country, so no longer be eligible or sadly died. I mean, this is, for a study that's been running for 46 years, it's amazing that we still observe so many, and really testament to the hard work of the people who are keeping track of cohort members, keeping them engaged and conducting the surveys in a way that means we retain as many as possible. But we can see from this that there is a considerable amount of missing information. So we do need to be aware of that in the when we're conducting analyses, what the consequences of that might be, and that's the topic of discussion today. So BCS 70 started off at birth really as a birth survey. The focus was very medical, so we collected a lot of information about the pregnancy, the labour, the birth itself, and factors around that. the study has naturally developed over the years to include different areas of interest that are relevant to the life stage of the cohort members at that point in time. So in the school years, thinking more about the development of the child behaviorally in terms of their health, how they're doing at school, their attainment, and their family life and the financial circumstances and housing of their family. In adulthood, this broadens to think about the family in a different way in terms of partners and children, and then a lot more about those trajectories into employment, and then people's housing similarly. And as noted before, there's been lots of assessments of cognitive ability throughout the life of these cohort members. So the most recent wave of data collection at age 55 has been completed quite recently. The data are not available yet, but they should be available hopefully in November this year. So we're not really discussing these data in any of the results that we're presenting today, but this is just to flag that hopefully these data should be available soon and do a bit of promotion work around that. So again, these are covering similar kind of domains of data collection that we've been interested in throughout the adult lives of the cohort members. But you can see a few additional pandemic-specific areas of interest here around COVID, illness, and the impacts of that on employment and income in particular. If you're interested in finding out more about BCS 70, if you're in this webinar, perhaps you know a lot about it already, which is why I've only gone through very quickly some information over the last few slides. Then there's a couple of cohort profiles, this one from 2006, and then a recent one from last year, which is updating the cohort profile with lots of more recent information on what we've been collecting. Additionally, the CLS website has lots of information on BCS 70 and on all of the different studies that are run by CLS. And if you're interested in accessing data from BCS 70 or indeed any of the other studies that we run, then the main survey data are available free of charge under a standard end user license, which means it's very easy to download them very quickly from the UK Data Service. There's other data sets that have different licenses that have a bit more of a process behind them to access, such as linked administrative health data, but there's full information on all that between the CLS website and the UK Data Service website. Okay, so that was a very quick introduction to BCS 70. I'm now going to give an overview of the missing data strategy that we've been employing at the Centre for Longitudinal Studies in order to try and think about how we can best ourselves handle missing data in our cohorts and how we can provide guidance on that for users of our data sets. So if you've been analyzing data from these sorts of studies, these sort of long-running longitudinal surveys, then I'm sure you realize that some sort of missing data or non-response, as it's often referred to, is inevitable. Sometimes, this might be for a variety of different reasons, and that may lead you to have to handle this missingness in different ways. But some common implications are, once you've got missing data, if you're performing an analysis that's only on those individuals, those cohort members for whom you have completely observed data, then you're going to have a reduced analysis sample size, and that will lead to reduced efficiency in your analyses. So if you're estimating something simple like a mean or a proportion, or you're fitting a regression model to estimate some parameter or some fancy causal estimand, then this reduced efficiency will play out in terms of larger standard errors and wider confidence intervals. Perhaps more importantly, respondents will often systematically differ from non-respondents. And what this means is that amongst the subsample of respondents, there may be a threat to representativeness, meaning by representativeness that those individuals that we observe within our pool of respondents may not look quite like those individuals in the target population that we're hoping to make inferences to. And this can lead to the potential for bias, meaning that our mean or proportional regression coefficient may, when we estimate it in our respondents, it may not correspond well to the true value of that estimand within the target population. So over recent years, a number of principled methods for handling missing data have been developed and are now quite widely used, including multiple imputation, inverse probability weighting, full information, maximum likelihood. So there's a categorization of missing data mechanisms, or a taxonomy, I guess, that you may be familiar with: missing completely at random, missing at random, not missing at random. Not got very long today, so I don't plan to go into all of those, but just to note, and I think this is quite important to emphasize, that these principled methods that I mentioned here all rely on assumption that data are missing at random. This means that given the observed variables that we have in our analysis data set, the probability of missingness doesn't further depend on unobserved variables. But basically, that the observed information that we have is sufficient to be able to account for the unobserved information. Okay, I'm just going to briefly mention multiple imputation here, because this is one of the examples from the previous slide of a principled method of missing data handling, and one that we're going to be using in the examples today. So I think it's important that I briefly introduce it in case not everyone's familiar with it. So we would use this in a situation where we're conducting some analysis. Let's say we're fitting a regression model. The variables that we're including, some or all of them, are subject to some level of missingness. In order to use multiple imputation, we specify some appropriate imputation model, and this allows us to fill in the information in those variables that are subject to missingness. But we do this multiple times to create a series of imputed data sets. That allows us to, when we analyze each of those imputed data sets separately using the substantive or analysis model that we would use for a complete case analysis, and combine the results across those imputed data sets using standard rules referred to as Rubin's rules. This approach allows us to correctly account for the uncertainty due to that missing data. So which variables should we be including in our imputation model? Well, we certainly need to include all the variables that are in our substantive or analysis model, and that includes our explanatory independent variables, as well as our outcome, our dependent variable or variables. But also, if there's other variables that we're interested in sort of interaction terms and other non-linear features of the data, we would need to include those too. And one thing here that we're utilizing in our missing data strategy is that we can also include auxiliary variables in our imputation model. So these are variables that are not included within our substantive model, but just that we can optionally include within the imputation model. And the variables that we would like to include here are those that are associated with the underlying values of the variables that are subject to missingness, but particularly those that are also associated with the probability of missingness, so the likelihood of individuals not responding to a certain question or a certain wave of data collection in the context of these long-running longitudinal studies like BCS 70. So the strategy that we've been employing over the last few years across the cohort studies in CLS, is trying to use this last point here to help us handle missing data in a more effective way. So these auxiliary variables that we can include in our imputation phase, this is often employed in methods that you will see being applied in the literature. But often the variables that are selected for these for inclusion as auxiliary variables are done in a somewhat ad hoc way, in that it's reliant on perhaps on pre-existing theory or just using variables that have been used by other researchers in previous applications. But what we're trying to do in this strategy is to maximize the plausibility of the missing at random assumption by optimizing the set of these variables. By doing so, by maximizing the plausibility of the missing at random assumption, then we're improving the way in which these multiple imputation analyses work and reducing bias to the maximum possible extent. So the idea behind this, and Michaelis will describe in some detail how we've been doing this in BCS 70, is to use systematic data-driven approaches to help us identify variables that are important predictors of non-response at each wave of data collection. And these variables are really the ones that are associated with the missingness that we get on an analysis-specific basis, as I'll describe a bit more on the next slide, I think. These variables can then be considered for inclusion as auxiliary variables in our missing data analyses. And so you can see here on the previous slide where I say when we're including these auxiliary variables, we're interested in those variables that are associated with the underlying values of the variables subject to missingness. So once we've identified these variables that are associated with non-response at each wave, we can look within those and consider which of them are likely to be or are empirically strongly associated with the variables in our particular analysis. And there'll be particular interest in including those as auxiliary variables. And really here, the key point is that we've got this incredibly rich data resources because we've been collecting a lot of information on our cohort members over many years or decades. And this sort of approach allows us to capitalize on that to improve the way that missing data are being handled. So why are we focusing on wave non-response? So meaning when cohort members fail to respond at all at a given wave of data collection. So here, this is the main driver of missing data in the CLS studies. Item non-response, so when a cohort member does respond to a wave of data collection, but just doesn't respond to a certain question, is less of an issue. And therefore, that's why we focus on identifying the factors that are associated with non-response at the wave level. This is also a kind of pragmatic decision because it allows us to do this in a way that's very general and not attached to any specific individual analysis. So we can do this at the cohort level, and these are exactly the analyses that we've been conducting and that Michaelis is going to present in a minute. And there will be some cases that your analysis is including variables which are more susceptible to item non-response, and this might need some additional consideration. So we know some variables tend to have greater levels of item non-response. For example, people are often reluctant to or unable to report their income. So when you ask about that, well, there will tend to be higher levels of non-response. So if your analysis includes a variable like that, you might want to give a bit of additional consideration. So as I say, we've been rolling this missing data strategy out across our cohorts at CLS. And this is just to show a few publications resulting from that. So this is a paper in the Journal of Clinical Epidemiology looking at the application of this missing data strategy in the 1958 cohort, NCDS. This is some additional work that we've been doing around that's in a letter that's in Longitudinal and Life Course Studies. In Next Steps, we've recently published some work, again, rolling out a similar strategy for identifying important predictors of non-response and demonstrating how these can be used in subsequent analyses. This is a recent preprint in BCS 70, and this is the work that Michaelis is going to present in a minute. And this is also some recent work where we've been trying to extend this strategy by using a similar data-driven approach to identify predictors of survey non-response, but now in linked administrative data here in hospital episode statistics to see if we can utilize that information to better handle non-response. So an extension of the strategy. Some additional resources that are available. So this week, we've just published this new Handling Missing Data in the CLS Cohort Studies user guide, which is really an update of a previous version that we had that was specific to NCDS. So this now covers in a bit more detail all of the other cohort studies. So you'll see in the appendices at the bottom, this gives you lots of information on all of the identified predictors of non-response from across the CLS studies. And it's quite a lengthy document, lots of information in here, including a running example where we go through and look in some details at the different stages of analysis. If you're interested in accessing this, you can currently get it by going to the CLS website, using the Publications and Resources drop-down menu, clicking on Documentation, including missing data as your keyword, and it should be there. It's only just been published, but it will subsequently, when we update the rest of the website, be linked to from a variety of different places, including the Handling Missing Data page here, which we're just in the process of updating. So if you come back in a few weeks or months, then I think that this will have been updated and be a lot more informative. And you can access this using the Data Access and Training drop-down menu and clicking on Handling Missing Data. So lots of information available, and it's going to be updated further in the coming weeks and months. Okay, great. I might have overrun fractionally there, but I'm going to hand over to Michaelis now, who's going to talk about the application of this missing data strategy in BCS 17.
Okay. Thank you very much, Richard. I will present you how we identified predictors of non-response in BCS 70. Actually, we implement a very similar approach that has been used in NCDS, as Richard mentioned before. And our main aim, was to maximize the plausibility of the missingness at random assumption using a data-driven approach. And we identified the variables that were associated with non-response at each sweep. So these variables could be potentially utilized as auxiliary variables in the models. So in brief, if we want, to present our approach, we have identified variables which predict non-response at each sweep of BCS 70, and those variables can be used, as we said before, as auxiliary variables in subsequent analysis to increase the plausibility of the MAR assumption. And we implemented a simple test analysis that has shown that this approach perform well. This is through an internal and external validation process. This is a relatively straightforward approach that can be easily implemented with standard software. And in this CLS user guide here, you can find the list of predictors of non-response of BCS 70 and of course of other studies as well. And this user guide will be updated when new waves data will become available. So what is like the problem? The problem is that we have no response. As you can see, from this figure, especially after age 16 onwards, the non-response is from 50% to 65%. So the response is from 50 to 65%. So we have a lot of non-response there. Well, for these three first waves at age 0, age 5, and age 10, the calculations are not very accurate because individuals who were not resident in the UK in 1970 were added later between age 5 and 16. And hence they affected the response rates between these between sweep 1 and sweep 3. But still, you can see that after age 16 is really like the problem. So when we go and we analyze sweeps after age 16, we really have, to tackle missing data because lots of people are missing. So for this approach, we utilized more than 20,000 variables in BCS 70 from across, sweeps 1 to 10, and we utilized the 18,000 more than 80,000 individuals in BCS 70. As we mentioned before, initially we had 17,000 and approximately 1,000 individuals were added between sweeps 2, 3, and 4. We excluded the rooted variables and binary variables with prevalence less than 1% and variables with item non-response more than 40%. And we also use summary scores. And for non-response at a particular sweep, we use the same three-stage approach as in NCDS. Well, a very, very similar approach as in NCDS. We changed some of the cutoffs. More in detail. So for a particular at a particular sweep T, for example, for non-response, the first we had like a three-stage approach. The first stage we run a univariate regression, a Poisson regression for predictors at sweep 1 up to T-1. For stage 2, we used multivariate regressions for predictions from sweep again 1 up to T-1 separately, and we retained predictors with p less than with p-value less than 0.05. And at stage 3, we ran a multiple imputation in which we utilized multivariable regression for all the previous predictors from all the previous sweeps, adjusted for predictors at the previous waves. And then we retained predictors with p-value less than 0.001. and some variables, 4 variables like sex, country of birth, participation in all previous sweeps, and father's socioeconomic status are contained in the final set of variables here directly at sweep 3, because we do expect that these variables will make it in the first 2 sweeps, and hence were not included, in this formula from scratch. So if you want, to have an overview of how this formula worked, we initially started with more than 20,000 variables, but we excluded, as we mentioned before, the rooted variables, and these are like questions that depend on a previous response to a previous question. Variables with more than 40% missing, variables with categories including 98% of cases, recoded variables with categories less than 1%, exclude all binary variables with prevalence less than 1% of cases if possible. We use the index or score variables, etc. So from these 20,000 variables, we utilized for this 3-stage approach like 967 variables, and then we ended up with a moderate set of variables as important predictors of non-response at each sweep, and this number of variables varied from 7 to 16. So if we wanted, to have an overview, you can see that here. You can see these are like the 10 sweeps, and you can see the stage 1, stage 2 here, and finally the stage 3, where we combine all the previous information from all the previous sweeps. So you can see here that at the end of the day, the total variables that we have utilized that can be utilized as auxiliary variables vary from 7 to 16 here. And we found out from this process, from this data-driven approach, that the consistent predictors of participation were methods for contraception, and these were important predictors for non-response at early sweeps, paternal completion of education, again for early sweeps. When we say early sweeps, we mean up to age 16. A higher early life cognitive ability. This is for adulthood only, adulthood more than age 26 onwards. Being female for the later sweeps. Few household moves for the later sweeps. Social participation, voting, again, this is for sweeps in adulthood only. Home ownership in adulthood. And these 3 variables, parity, which means number of older siblings, participation in previous sweeps, and paternal social class, both for early sweeps and also in later sweeps in adulthood. So these were like the variables that we have identified as consistent predictors of non-response, either at early sweeps or at later sweeps, or both. So someone now will ask, okay, does this method really work? I mean, how can we know that this methodology works when we want, to recover the distribution of our initial variable, for example, or when we want to assess a causal effect between our exposure and our outcome, and our analysis suffer from missing data. Here we'll see 3 different examples that we presented, in our work, and this worked as an internal validation, really, that our method works. So the first example is about paternal social class at birth, and we saw that in more than 16,000 individuals at birth, we saw that 5% of the parents of the father's professional father's social class was professional. So 5% of them had professional social class, and this percentage remained the same actually among those individuals who were alive and were not like immigrated by age 46. However, at age 46, when we wanted, to analyze this particular sweep, in which we have only less than, 8,000 individuals, we saw that this percentage was more than 6%, so the percentage in professional social class. So we wouldn't really trust, this number, because, our analysis would suffer from bias due to missing data. So what we did is that we implemented multiple imputation by chained equations. We ran 50 imputations, and we used as auxiliary variables or predictors of non-response that we have found from the previous procedure at sweep 10, which is like age 46. And we utilized information from sweeps 1 up to 9. So when we implemented multiple imputation, we saw that this percentage went down close, to the initial percentage of 5%. So this is like 5.2, 5.3%. And with this multiple imputation, we went back to this sample of 15,207. So in a way, this approach in a way validated, that our method work, and we can restore representativeness of our sample, especially, for this variable. But we went on, and we presented this approach also for another variable that was from the second sweep at age 5. So this was like mean cognitive ability, which we had at age 5, and we saw that this was close to 0 also among those individuals who remained alive and did not immigrate by age 47. However, when we analyzed respondents at age 46, in which we missed almost, half of our sample size here, half of the sample size of the of stage 2, we saw now that the mean cognitive ability is like completely different. And again, this result would not be like representative of our study. So what we did is like a similar approach again. We implemented multiple imputation by chained equations. We used 50 imputations. We used all these auxiliary variables, all the predictors of non-response at sweep 10 from all the previous sweeps, and we see here that we again we restored this initial representativeness. So our method really works for to recover representativeness for the distribution of variables both at the initial sweep and also at sweeps after baseline, let's say. But apart from that, we moved on, and we wanted to see if we want to perform, for example, Cox regression, and we want to estimate the causal effect. We want to see what is like the causal effect of father social class on participants' mortality after age 26. So when we want to assess causal inferences, does this methodology work? So that's like the example that we have here. So, and we did this analysis in the original sample, of 15,800 individuals, in which we saw that the hazard ratio of partially skilled or the manual workers versus the unskilled or other was close to 0.75, 0.8. That was like the hazard ratio initially. Now, if we wanted to use the complete case analysis, among respondents at age 26. Again, we have this variable from the initial sweep, so we didn't have, to drop those participants. But if we drop those participants and we perform the analysis only among respondents at the age 26, we saw that the hazard ratio, the point estimate of the hazard ratio would be close to 0.6. So it would go down, even if the confidence intervals are quite large. So again, we implemented this procedure, the multiple imputation by chained equations. We use all auxiliary variables up to this sweep. So we went back to our original sample, and we saw that the point estimate is 0.7, which is very close, to our initial estimate from the original sample. The same results we have when we compare the non-manual and those whose work is non-manual and managerial versus the unskilled. We saw that the hazard ratio on mortality, when we compare these two groups, in our original sample was close to 0.5. This hazard ratio goes down to 0.4. So the point estimate goes down among respondents, but you see, that among respondents we lose almost half of our initial sample size. And then when we implement multiple imputation by chained equations, we go back to this original sample, but also our point estimate. So when we go from this complete case and we implement multiple imputation using all auxiliary variables, our point estimate is now very, very close to our initial point estimate. And the same also holds for when we compare those who have a professional social class, and we compare them those versus the unskilled. The hazard ratio is 0.8, the hazard ratio on mortality. Again, among respondents, when we lose almost half of individuals, the hazard ratio goes to 1. But when we go to this sample and we perform multiple imputation, then we saw that the hazard ratio goes back to 0.8. So this is an indication that in these three completely different examples, the first two examples was about to restore representativeness and see what is like the distribution of a variable, and the third one, again from an internal validation, was to see what is like the association or the effect, depending on the analysis of our exposure to our outcome. We saw that in these examples we achieved this. We went back to we recovered the bias that we have due to missing data. So now someone will ask, okay, in practice, what should I do? Okay, you implement all this methodology, okay, but now I have like problems with my analysis where I utilize the BCS70 and I have to address problems due to missing data. What should I do? You should not do all everything from scratch. You go from our data user guide, and based on the sweep you want to tackle missing data issues, you select the predictors of non-response that you need. And then, for example, you may want then to implement multiple imputation, and these variables can be used as auxiliary variables in your imputation model. So, for example, if you want to tackle missing data at sweep 2, you go in this in our user guide, and you select these variables from sweep 1, which is at age 0, and you see the variable description, the variable name, and then some details, what are like the categories that you will utilize. Some of these variables have been like recoded, but we present the categories that we have. this is for sweep 5, the same approach. I just present 3 different sweeps in which, for sweep 5, you utilize these variables from sweep 1, these 2 variables from sweep 2, these 3 variables from sweep 3, and this variable from sweep 4, and also, no response at all previous sweeps. And for sweep 10, for example, again, I select at random, 3 different sweeps in which you have to utilize, 16 variables. You have to take information from sweep 1, sweep 2, 3, 4, 5, 6, 7, and 8 and 9, and also use, no response at all previous sweeps. And again, as we mentioned before, these variables can be used to restore representativeness and present summary statistics of the characteristics of individuals, but also assess causal relationships between your exposure and your outcome, of course, accounting for all potential confounders. So, in summary, we have identified, these variables which predict the non-response at each wave of BCS70. We mentioned that these variables can be used as auxiliary variables in subsequent analysis to include the possibility of the missingness at random assumption. All these list of predictors of non-response can be found online, so you don't have, of course, to do this process from scratch. You just go and take the information of these variables and you use them in your analysis to tackle missing data issues. This user guide will be updated when new waves of data become available. And our work we hope that will facilitate, researchers who plan to utilize BCS70 and help them address bias due to missing data. So that was it, and thank you very much for your time.
Great, thank you very much, Michalis. And I think, so one thing I just wanted to emphasize is that although we've been using multiple imputation in our example applications throughout, as I mentioned at the start, there are other principled methods for missing data handling that you may prefer to use instead of that. And so the important predictors of non-response that we've identified can feed into those other methods in fairly similar ways. So they can be included within your full information maximum likelihood approach. And if you're interested in using inverse probability weighting, then these are exactly the variables that you would want to include in your response model that you use, or your analysis sample model that you would use in deriving the weights that you're going to use in your inverse probability weighting. And in the missing data user guide that we linked to earlier, there's an example of doing exactly that, comparing how you would perform the same analysis using the same auxiliary information, both using multiple imputation and using an IPW approach.